The second speaker is Prof. Donny with the Advance in Understanding of Retina in Abusive Head Trauma and Current Understanding.
Thank you. So I think I actually like to kind of walk around a little bit. So I'm going to be talking about the current research on abusive head trauma and the retinal findings for 2025. And this is an area that I have a lot of passion for. And so let's just briefly talk about the retinal hemorrhages and also the etiologies. As you know, when you see a child coming in with a retinal hemorrhage, the differential diagnosis can be quite extensive. When after all those things are ruled out, then you can possibly think about the abusive head trauma. But the problem is that there's a lot of disagreement in terms of the pathophysiology and also the findings. And so that's where, that's how the research got started, because I actually had a patient with the retinal hemorrhage, but we actually had some disagreements. And this case had to go all the way to court. And the outcome was very undesirable, and it just made me feel horrible. So the first dilemma is that there are many, many different medical causes that can cause retinal hemorrhage, and so are the traumas. And the second dilemma is that how do you know if something was truly accidental or if it was intentional? I mean, these are very difficult questions that one has to address. So the accurate diagnosis is extremely critical because the false negative, can you imagine taking this child back to the home of the abuser and the child end up dying? And as you know, these things happen, but the false positive has just as much bad impact. Think about what it does to the family. As a matter of fact, in the United States right now, we're not talking about the accuracy of the diagnosis. There's a case, there's a gentleman who's on death penalty for child abuse right now from Texas. So getting the diagnosis accurately is extremely critical. So my aim was to use AI for assistance. See if we can, there's lots and lots of technology out there. So I wanted to take advantage of the AI. And number two, I wanted to estimate the force just based on looking at the retinal hemorrhages. Just estimate if that retinal hemorrhage is consistent with the history or not. Because if it is not consistent with the history, then it requires further investigations, of course. And lastly, I wanted to look at possible treatments, because many of these patients, as you know, have severe cortical vision impairment as well as the amblyopia. So I wanted to see if there's something that can be done. So I'm going to try to address all that in the next 8 minutes. So retinal hemorrhages, when you look from far away, they look somewhat similar. I mean, you've seen retinal hemorrhages from diabetes, macular degenerations, and it can be very, very daunting. But if you look very carefully, each one of those hemorrhages have special patterns that we're not going to really go over during this talk, but they all have unique findings, and there's a reason for that. So we collected images from different parts of the world, from Korea, US, and Australia, of different various causes, and we broke them down into medical and trauma cases. And these are confirmed cases of trauma cases. So if it was an abusive head trauma, it was confirmed cases, it was court confirmed, or multi-specialist confirmed that it was a result of abuse. So these are not equivocal cases, these are confirmed cases. And then they were labeled, and then we had 5 experts around the world and looking at these images, and we annotated them. What does that mean? So we identified, delineated the retinal hemorrhages, and then we looked at whether it's a pre-retinal, intraretinal, or subretinal. And if there are areas of retinal schisis or retinal detachment, it had to be specifically annotated. So it was a daunting task, and we took lots and lots of time. And then these images had to be pre-processed and then augmented. What does that mean? So pre-processed. There are many types of retinal cameras out there. As a matter of fact, if you look at the exhibition hall, there are more coming. And as a matter of fact, there are actually retinal image cameras coming right now. That's not on the market. So within the next 2-3 years, I think it's going to be very exciting. But many of these images were taken by different cameras with different lightings, different sizes, different frames. So it had to be pre-processed to make it uniform. And then we had to augment it. So what does that mean? So every time the model was asking for a new image, the AI would generate an image by rotating it, by flipping it, changing the brightness. And by doing this, the AI actually can expand the number of images and make it more accurate. So this image can be flipped and rotated and framed in a different way, like this. So for example, here, this is me. But if I provide images with wigs, like this, remember, this is still me, so the computer, the AI, would have a less chance of misidentifying who I am. If I show up with different outfit, different hairstyle, different makeup, you see, it can still identify that it's me. So, and then it had to go through a deep learning. What does that mean? So these images had to be broken in and down to small filters. I'm going to just kind of explain this. Small filters, and these filters are combined and analyzed in layers, as you can see there. Then each layers they're built on each other, on the previous ones, and then you start to form a very complex patterns. And then by analyzing many different images this way, then it can start to recognize patterns that it has never learned before, that it has never seen before. And then on top of that, it can recognize patterns that we ourselves cannot recognize. For example, males and females. I can't do that. I don't think anybody can here. But it can start to identify things that we just don't recognize. So what we found that the accuracy of our program was about 95 to 96% of differentiating medical versus trauma. What does that mean? So here's our first image. Here. Okay, here's our first image. As you can see, this is an actual diagnosis was from a trauma, and the AI would give us the medical predicted probability was 2.15%, but the probability of it being traumatic was 97%, so it was accurate. And then for the medical diagnosis, it was the same thing. And then the big question is, how do you know if something was accidental or if it was intentional? Okay, so this is very, very difficult because is the retinal exam, you could actually rephrase this and say, is the retinal exam consistent with the history? Is the force applied to the retina based on history consistent with what you see in front of you? So for this, to answer this question, we developed a very complex and a finite element computer simulation model, not just the eyeball, but including the muscles, orbital fat, the orbit, the skull, the entire headset, as you can see here. And we had about 1 million small points that we could analyze simultaneously when we do something to this eyeball. So for example, here, also we were looking at the optic nerves. We wanted to see exactly what happens to the lamina curvosa. We wanted to see exactly what happens to different layers of the retina and the sheath as well. And then we shook this eyeball like this, similar to the doll model. So when you shake this model, similar to the doll model, we're able to see the exact vertical, horizontal positions. Not just that, we could see the velocities and accelerations and decelerations of this eyeball at all million points simultaneously at a thousandth of a second, which is almost impossible for us to do. So here, this is what we saw. So when you look at the retina, the average stress was about 7 kilopascal along the vessels. What is 7 kilopascal? This thing right here, applying force, like putting this on a table, that's about 7 kilopascal right here. So that's about the amount of force that I'm applying to the blood vessels. And wherever there was a bifurcation of the blood vessels, because there's a more direct contact, there's an adhesion of the vitreous to the retina, there's a greater force of 9 to 10 kilopascal. And that's the reason why you see retinal hemorrhages in all periphery, not just in the macula, because there are more bifurcations in the periphery. And then when you look at the pre-retinal, intraretinal, and subretinal, all three layers, they're all similar. the amount of force that was being applied to these three areas was very, very similar. Now, this is going to become very important in just a little bit, okay? So now we looked at all different type of sports. We looked at baseball, soccer, pickleball, and we wanted to see exactly how much force is being applied to the eye in what patterns. So here's a pickleball hitting the eyeball, and this may just seem like a very simple picture. There's actually a lot that's going into this picture, because remember, we can analyze any points in the retina at thousandth of a second of 1 million points. So what does that mean? So here, you can see the force. As it contacts the cornea, that force is being propagated in a translational fashion, but moving back and forth and back and forth. So there's a vibration. And if you look very carefully, I'm going to just show you that force is it's very positive initially, and then as it bounces back, it creates a vacuum. It's almost like a pulling force, attractional force. Probably that's what's resulting in retinal schisis. And another thing is that, as you can see, most of the force is concentrated right at the optic nerve or the macular area. And that's also, when we look at all three layers, you can see the greatest amount of force is being applied to the pre-retinal rather than a subretinal layers. And that's probably the reason why you see more pre-retinal hemorrhages, more concentrated in macular area in patients with sports. I'm going to show you some pictures of that. And also, with the abusive head trauma model, with the oscillation, with the shearing force, the force continued to climb versus the force of the trauma, which declines very, very quickly at a 1/100th of a second. So it's a very different type of pattern. So when you look at the hemorrhages for abusive head trauma, it's pretty much all in the periphery wherever the bifurcations are, but in the sports, it's mostly central with possible retinal schisis. So what we're doing today, right now, is that we're collecting more retinal hemorrhages, and using AI, we're trying to, by looking at when the picture is provided to us, we're trying to quantify the force based on retinal images. And then what we're doing is that that's going to help us to determine whether the force that was applied to this retina is consistent with the history. And if it's not consistent with the history, then you're going to have to assume there's something else to the story that requires further investigation. Okay? Remember, our job is not to determine if something is abused or not. Our job is to determine whether the picture is consistent with the force that was applied. That's it. And then what we're doing here is that we are doing animal studies with mice, monkeys, and lambs. And so here's a mice. Oh, sorry. I had to keep this video pretty short. Oops, sorry. It's not working. But I didn't want to show, right after lunch, I didn't want to show mice being shaken at 5 hertz. It doesn't look very pretty. But these mice these are 6-day-old mice, and we shake them at 5 hertz for 5 minutes, and we're looking at the retinal structures along with OCTs and SLO-ERGFAs, and then histology and immunohistochemistry. And what are we doing? Why are we doing this? So when we look at the OCTs and FAs and ERGs, and also the histology, there's actually a lot of things that we're finding. For example, look at this histology. And you see the melanin that's dispersed from the RP into the photoreceptors right here. And it's being released into the photoreceptors. And we don't really know what this does to the photoreceptors, and also specifically the Mueller cells, which I'm going to talk about just a little bit. And also, you can see this. You can see the RP layers splitting as well. So what we're doing is that we're specifically looking at the impact of the melanin in the photoreceptors, also the Mueller cells. The Mueller cells, as you recall, it's kind of like a pillar of the retina. It starts from the external limiting membrane all the way down to the internal limiting membrane. It's the only cell that expands the entire retina. And during this force of shaking, the shearing force is probably causing some disruption of these Mueller cells and causing some type of dysfunctions. And we're using RNA probe to look for the cell function of the Mueller cells to see what is exactly happening. And so we can find the biomarkers and potentially find some treatments. And these are the, I mean, as you can see, this is a humongous, it's a huge, it's a daunting task. And we have a huge team all over the world that's helping us. And if you're interested in helping us either with providing images or providing any feedback, that's this is my email. And please, please send it to me, and I welcome any questions. Thank you.
Thank you, Professor. Very interesting presentation. If you have any question, please ask to Professor.
I know this is going to take some time for you to just kind of sit and think it through, because I put in about 3-4 years of my life into this. So if you have questions, I'm going to be around, and you can please come to me and ask me. And I feel there's so much more into this. There's so much more. As a matter of fact, some of this project is being presented tomorrow at the Trauma Conference, the American Society of Ophthalmic Trauma, tomorrow. So if you have questions, please come and look for me after the meeting. Thank you.
There's one question.
Oh, yes, please, Ken.
Fabulous work. The only thing I'm a little confused about, I've seen more macular schisis in documented non-accidental trauma than accidental trauma. But in your presentation, you were saying that you see more schisis in the traumatic, or at least that's the picture you showed.
Yeah. So thank you very much. The question was that do you see more the pathophysiology of macular schisis? Do you see that more with trauma, or with the accidental trauma versus a non-accidental trauma? I'm just going to tell you this: the picture that I showed was from a motor vehicle accident. So the force has to be pretty significant for it to travel translationally and hit the macula and create a vacuum to tear the retinal tissue. The amount of force that's required to cause retinal schisis, we're expecting about 20 kilopascal, which far exceeds the shaking. So you really have to, so the first thing, number one, the force has to be pretty significant amount of force to cause retinal schisis. So if a child fell and you see retinal schisis, that's inconsistent, number one. And number two, if you see retinal schisis in a potentially abusive head trauma, the amount of force is significant enough that you should really see significant amount of retinal hemorrhages in the periphery. Because remember, the amount of force that's applied to the blood vessels at the bifurcation is about 10 kilopascal. And the retinal schisis has to exceed that. So the amount of force of shaking has to be pretty significant. By the way, when we shoot these computer simulation model, or the baby dolls, it was only at 2 hertz. It was 2 hertz. So you're talking like this. We intentionally made it 2 hertz so that it's pretty easy to do. But if you're shaking at 3 hertz with a lot of anger and intensity, that number of 10 kilopascal can reach the 20 kilopascal. Thank you very much.
Thank
guys.
you, Donny. Just I had one curious question.
Yeah, please.
This is an excellent work, and I agree it's a humongous work. Just had one curiosity. What happens to the woodpecker retina?
Thank you. Thank you. You know, I'm actually very happy right now because these questions are great. The woodpeckers, you know, the lawyers, when you go to court, the lawyers will make a comment. How about the woodpeckers? They don't have retinal hemorrhages, and they're vibrating at 3 to 4 hertz. So they're shaking their head 3 to 4 hertz. Number one, there are only very few animals. Actually, I learned about. You remember, I studied the animals. There are only very few animals most of the mammals are not holoangiotic. So the monkeys, the humans are holoangiotic. That means that every single cells have blood vessels reaching it. You understand? But woodpeckers are not holoangiatic. It lacks the blood vessels. It only has very few blood vessels. Number one. Actually, there's a lot more. Sorry. Number one. Number two, the lens of the eyeball is just like the mouse. The reason we have to shake the mice at 5 hertz instead of 2 hertz is because the lens occupies about 90% of the vitreal space. So the lens provides a lot of cushion. And the birds are the same way. That they provide a lot of cushion. And the vitreous is much dense, much more dense.
Thank you.
Thank you. Thank you very much.
Thank you very